So our next speaker is Professor Nino Museridze, who's Professor of Obstetrics and Gynecology and the Clinical Director of the Georgian and German Reproductive Medicine Center, also from Georgia. And she's going to tell us about stem cells, exosomes, and PRP therapy in male and female fertility. Thank you.
Good evening, ladies and gentlemen, honored guests and East colleague. I'm pleasure to be here. Thank you to inviting me to this conference, and I am very glad to see Professor Seror here in Egypt. Thank you, and my presentation is about stem cells transplantation, exosomes, and PRP therapy, medicine of the 21st century. 50 million couples in worldwide with infertility. And it's an honor to be speaking before you today on the latest advancement regarding the role of exosomes in reproductive health. Last year, we discussed mesenchymal stem cells transplantation. I am proud to share that the first baby in Georgia has now been born using mesenchymal stem cells transplantation. Today, we are discussing exosomes and their significance in reproductive medicine for both female and male infertility. Stem cells, it's a new reality in infertility. Welcome to reality, and we are constantly exploring ways to extend the reproductive lifespan in women and the men who face conditions such as azoospermia and cryptozoospermia. We are also working to assist oncology patients who may not have preserved their biological material. Around the world, researchers are focused on the issue, and I'd like to highlight some revolutionary development in Israel. The researchers there have successfully created artificial sperm cells, artificial oocytes, and even artificial embryos. And they have even managed to extract DNA from the skin cells and transform it into reproduction gametes. And we are all waiting to see how this is performed in the fertilization process. And this research is especially significant for countries where surrogacy and donation is illegal, and it's Egypt too. And many people who wants to have children with their own gametes, and we are committed to making the possible the advancement in involves range professionals, but particular scientists working in genetic engineering and stem cells research, and we want to meet new life and new families with happiness. Stem cells. Stem cells, especially mesenchymal stem cells, and have a unique ability in renew cells and transforming in various cell types. This combination of cells renew and differentiation markers, MCC, valuable for regenerative medicine. Common sources of the MCC include adipose tissue, bone marrow, and umbilical cord tissue. MCC derived from these sources and generally safe for therapeutic use and are especially useful treating reproductive conditions, and because they are potential repair tissue. In reproductive health, MCC are used support to repair and growing reproductive tissues, and for example in women can exchange the endometrial lining, increase ovarian reserve, and improve implantation rates, and in men have show potential in supporting them development and improving testicular function. These cells migrate to damaged areas and realize that help restore tissue function and make them promising tool for both male and female infertility. Look at this and the preparation. Preparation of this tissue, it's not neither easier, not difficult. We use the ultra-sharp blood blenders that the releasing of the stromal cell form parenchymal cell in adipose tissue instead enzymes, because enzyme is not so good for stem cells because that proliferation is stopped. Look, white adipose tissue, more than 80% tissue fraction contains stem cells. And I will show you the evolutionary mechanical stromal cell isolation systems from 2013 before 2020. And it's very, very difficult. And as you know, these are two main sources of regenerative cells in our body. The first is the blood, and we frequently use PPP and PRP in our clinical routine. And the other of the most important sources is adipose tissue. And look at this, and two ways to enter to endometrium. And for Asherman syndrome, we use office hysteroscopy, and you see before injection at a stem cell transplantation and after injection. Oh, sorry. It's a before. Oh, no, we do not correct. Okay, maybe like this. No. Okay, and I will show you before and after injection glands. And we use MCC for Asherman syndrome injection, and after 2 months, you see glands in the endometrium. After, we can use it to ovary and PRP toast and inject to ovary. And after injection, after 3 months before injection, you see the morphological picture, and after 2 months after injection, morphological treatment. And we need sperm. Okay, stem cell therapy for male infertility takes a step forwards. And what do we treat? Infertility, and sometimes the tests are not so bad. Spermogram, it's very terrible, and sperm, but IVF does not always any results. And if the process is after transplantation, for cryptozoospermia, 4-6 injection points on each side of the median line. Exosomes is a particular play a crucial role in the emerging field. Exosomes are small extracellular vesicles about 1/1,000 size of a cell secreted by cell to carry bioactive molecular-like proteins and RNA and a signaling molecule. Exosomes from MCC, after many of the regenerative properties of the stem cells themselves, and make the powerful tools for the cell communication and repair. And look at this mechanism on action. In infertility treatments, exosomes are used not only for the stem cells like regeneration, all for specific paracrine effects that ability promote communication, tissue repair, regulate immune response, and support angiogenesis, all which is crucial for reproductive health. Like MCC, exosomes also improve endometrial tissue, ovarian reserve, and implantation success in women, and they support sperm development and testicular function in men, anti-inflammatory effect, tissue repair, and angiogenesis. And the shelf life from exosomes, -18, 24 months, -20 is 6 months, and +4, only 1 week. How is applied? Immunomodulation and cell communication, regenerative abilities, development of endometrial tissue, increased ovarian result, implantation rate success. Male infertility. I think it's very good results after for cryptozoospermia, and 5 billion exosome particles in 2 milliliters of volume. And we inject them, and so stem cell and exosome have much in common, and both can yield similar results. However, they act differently and regeneration. Stem cells work directly by differentiation into the cell needed for repair, and exosomes act indirectly functioning and cellular messengers that deliver legit instruction to the other cells. They contain tenders and signaling molecules and promote healthing and have shows that the exosomes can be effective repairing reproductive tissues and improving fertility outcomes. This makes that both excellent choice with comparable results for reproductive health. And the method or derivation can be performed under local anesthesia on general sedation. We choose the location for fat collection, usually abdominal area, and the fat aspirate manually using the mesh cannula. The different production stage of exosomes with the removal for apoptotic bodies are important. Kit for obtaining and treat adipose tissue. And you see how we prepare mechanical the adipose tissue and take from there with PRP therapy stem cells. And the treatment 40 milliliter adipose tissue, about 4 milliliter stem cell fraction, and 1 milliliter for 4 or 8 million stem cells. And look at this, 38 years old, we are more than 8 million stem cells. And age 43, about only 2 million stem cells from adipose tissue. And it's very important, age is every time important for women. After stem cell transplantation, we use, of course, for testicular, for endometrium, and ovary injection. And in Georgia, it was first time to use stem cell transplantation and exosomes in male infertility. And PRP, mesenchymal stem cells, and exosomes injection of with PRP into the ovarian games women and change to have a baby with their own eggs. What's remarkable, and that's displayed, the difference that both stem cells and exosomes have shows very similar positive outcomes in treating reproductive conditions. And in men, and exosome supports sperm development and improve particular health, especially in cases of low sperm count and sperm quality. Conclusion: stem cells and exosomes with PRP and PPP therapy represent background in the reproductive medicine. Their ability to support tissue repair, regulate immune function, and promote cellular communication make them powerful tools with similar outcomes for patients. As research continues, I look forward for seeing these therapies can be routine in reproductive health care, bringing hope to more people. In vitro activation, mitochondrial activation, stem cells treatment, exosomes, and biotherapies. PRP, it's a future of reproductive health. Thank you for your attention. And 2025, we are waiting you to Georgia in our Congress. Thank you.
Thank you very much. That was a fascinating presentation. I'm sure